Hi, I'm Dr. Nadine Spring, and welcome back to my channel, Springwell 360. Thank you so much for joining me today as we dive into this very important topic, diversity in clinical trials and its profound impact on health equity. What I want you to do is to imagine a healthcare system where everyone receives fair and effective treatment regardless of their background. That's my goal. And diversity in clinical trials is the key to unlocking that future. So, what exactly is health equity? Health equity means ensuring that everyone has an equal opportunity to attain their highest level of health. Let's remember that equity does not mean the same thing as equality. It's something people often get, they often get it confused. Achieving this health equity has been a long-standing challenge due to disparities in healthcare. One of the ways to get us to health equity is to have more representation in clinical trials. And there are a few reasons why diversity in clinical trials matter and why it's so important. Firstly, I'll talk about inclusivity in research. Clinical trials need to reflect the diversity of the population that they aim to serve. And without diverse representation, the efficacy and safety of treatments may not be fully understood. We also need to understand varied responses. There is a concept referred to as social determinants of health. Different groups might respond differently to treatments due to things such as environmental factors or even cultural factors. Diversity in these trials will help us to understand these nuances. We also need to consider personalized healthcare. It's really not a one-size-fits-all approach. Diverse trials will enable tailored treatments, ensuring that they're effective for everyone. We are all unique, and our healthcare journey should reflect that diversity. The power of diverse clinical trials is the cornerstone for tailored treatments, and this ensures their efficacy across varied populations. Diverse trials can also serve as the foundation of progressive healthcare, allowing for nuanced insights into how treatments affect different demographics. They enable us to understand the details and the complexities that exist within various groups, whether it's genetic predispositions to cultural influences or what I referred to earlier as social determinants of health. This understanding is going to empower researchers to tailor treatments, therapies, and interventions that are not just effective, but also inclusive and catering to the diverse needs of every individual. Tailored treatments would also result in fewer trial and error, where the person could try multiple treatments before finding the one that works best for them. Right now, this is very common in medicine. By advocating for and actively engaging in diverse clinical trials, it will revolutionize healthcare by promoting inclusivity and representation across all strata of society. I am personally committed to health equity, and this drives me to ensure that everyone, regardless of their background or their identity, has access to treatments that will work specifically for them. And this dedication to diversity in trials, it isn't just about advancing medical science. It's about transforming lives. It's about ensuring that healthcare isn't a privilege reserved for just a select few, but a right that's accessible to all. I am dedicated to being at the forefront of this movement, reshaping the landscape of healthcare to be truly personalized and inclusive. So where are we now? What's our current status? Well, unfortunately, the current landscape shows underrepresentation of minorities, LGBTQ plus communities, disabilities, women, and certain age groups in clinical trials. And this lack of diversity really hampers our ability to develop inclusive treatments. So how do we bridge this gap? How do we solve this? We know what the problem is, right? There are a few ways. We need to consider advocacy and education. We need to advocate for inclusivity in research, educating and empowering and informing communities about the importance of clinical trials, and breaking down barriers to participation. We also need to consider policy and industry changes, which, we need to encourage policies that prioritize diverse trial recruitment and incentivize inclusion. We also need to think about community engagement. We need to build trust and build partnerships within diverse communities to encourage participation and ensure that voices are heard. Overall, I want to share that diversity in clinical trials isn't just a matter of representation. It's about ensuring fairness and effectiveness in healthcare. By championing diversity, we pave the way for a future where healthcare is really and truly equitable for all, not just a select few. So thank you so much for joining me in this crucial conversation. And please remember to subscribe and join me next time.